update, I want to share with you in advance that the number is not quite what it seems. So we're reporting 612 new cases today for a total of 32,662. As happened a couple of weeks ago, we have 3 labs that are reporting for the first time today. These are 3 point-of-care labs that have results that go back several weeks that are all being reported today. And in fact, 317 of those 612 cases that we're talking about came from those 3 labs. So if you take those cases out of the mix, there are 295 of the 612 which are really new and in the last couple of days. We expect to see more labs coming on board in similar fashion as we ramp up testing, but we're doing everything we can to get them to electronically transmit daily results so that this doesn't happen. Sadly, we are also reporting 34 new deaths, which bring us to a total of 2,315 for the state of Louisiana. I also want to point out that yesterday, while we didn't have a press conference, every day we release new numbers right around noon, there was also a data error in hospitalizations that actually came from one of the hospitals in Region 9, and it was an input error. They hit the wrong number. And so if you looked at hospitalizations yesterday across the state, it looked like hospitalizations had increased. In fact, once we fixed the error, they decreased by 65 yesterday to 1,245. And the good news is that they decreased again today by 51. And so the current number of hospitalized COVID-19 patients across the state of Louisiana is 1,194. Oddly enough, vent usage went up by 1 today to, I think it's 147. One of the more impressive numbers, for me at least, because I know where we were when this started and so forth, is the fact that we now have completed almost 238,000 tests in Louisiana. And I did want to pause and just point that out and ask people to realize how far we have come in testing here in Louisiana. We did our first test on on February the 28th at the state lab. The commercial test actually didn't start until March the 12th. So now that we're almost 238,000 tests, and capacity continues to grow rapidly. And we're working with our federal partners at the CDC, at Health and Human Services, and at the White House in order to make sure that we ramp up that capacity as quickly as possible, have the best possible strategy in place for testing, and in accordance with the White House's recent nationwide call for COVID-19 testing in all nursing homes for residents and workers alike over the next few weeks. We are working on a plan that will accomplish that goal. We've known from the beginning that nursing homes are one of the places that are most conducive to the spread of the virus, and unfortunately it is inhabited by residents who are most vulnerable to the virus. And it's a particularly challenging situation because obviously people are in nursing homes because they need help. They can't care for themselves, and so you have staff that are going back and forth, and they can inadvertently introduce the virus into that particular facility, and they can do so while they're completely asymptomatic. And I guess that's one of the most challenging things about this particular virus and this particular public health emergency. The individuals who are either mildly symptomatic or asymptomatic, they have no idea that they have this virus, and yet they can be contagious.